I conferred with team members and folks who were in the different sessions, and it sounds like it was an amazing afternoon and latter part of the morning all around. So welcome back. This is our final panel of day one before our reception this evening. And I think, we talk a lot about the expansive mandate of gender equality and who needs to be in the room and really who doesn't need to be in the room. The answer is usually that everyone should be in the room. There's no one we should be leaving out. But we also all have our niche areas and our areas of expertise. And that's really what I'm seeing come out over the afternoon is these different different pockets of work that are all advancing gender equality, something that we hold near and dear to our hearts at the Canadian Partnership for Women and Children's Health, which is the host of the Equal Futures Network, of course, is global health programming that advances the rights of women and children around the world. And so we decided that the final panel of day one would focus in on that. So I will say nothing more other than to introduce Nicole Tobin, the head of programs and global health at Care Canada, who will moderate the final, not first, I can't read through this thing, final panel discussion today. Nicole holds a master's degree in international development and has worked in development focusing on health for over 20 years with a passion for increasing access to quality healthcare in areas where resources are scarce. She's passionate about creating a more equal world and believes that women and girls are at the center of making that a reality, which makes her the perfect person to moderate this concluding panel, The Future We Expect, Improving Health Outcomes for Women and Girls by Advancing Gender Equality in Sexual Health and Reproductive Rights, or SRHR. So I'm going to walk across the stage and then invite you to start speaking.
Je vais l'inviter à parler.
Here, a little bit of housekeeping. So this session is going to be in English today.
Donc maintenant, si quelqu'un aimerait, vous pouvez aller chercher.
Say that in French. So le panel alors si vous voulez de l'interprétation.
So if you'd like to have interpretation into, you can pick a headset.
Megan and Sophie. I believe
Virtuel. Je pense que vous pouvez les voir à l'écran. Okay. Maintenant, je vais présenter le sujet de cette discussion, les inéquités de genre. Okay. Donc, ça a une influence.
Experience crises or emergency situations, how they have exposure to disease, how they access healthcare, how they access water, sanitation, hygiene, and many other things. So a really important tenet of this is sexual and reproductive health rights, which is the focus of our session here. This is really because it's pivotal, it's bedrock for the gender equality and pivotal for achieving good health overall.
Okay. Okay. OK, quand on refuse l'accès aux services de contraception, avortement, lorsqu'on leur donne accès à ces services, le taux de mortalité infantile diminue. Donc, nous devons bien sûr parler de défis sur les droits reproductifs et l'équité des genres.
So this discussion of wonderful panelists, two on the screen and two in person, is going to be looking at all these challenges, thinking about solutions, and how we can move forward as a sector, as individuals in this fight for gender equality, for sexual and reproductive health rights. So I'll start by introducing the panelists before we go into questions. I'm going to start with Dr. Alia Bibi on my far left here. So Dr. Bibi is a seasoned public health practitioner with over 20 years of experience working in international global health sector, leading projects and providing technical support on sexual and reproductive health rights, health systems, strengthening nutrition, with gender equality, capacity building, and behavior change communication as cross-cutting themes. So she is the Senior Health Advisor at Plan International Canada, providing technical assistance to many countries in Africa, Asia, and North America. And she is a medical doctor with postgraduate studies in public health and global health. So welcome, Dr. Bibi.
Thank you.
On the screen here, thank you, yes. On the screen here, I'm not sure if it's left or right. I'm gonna say the one who has her hair down. We have Sophie Elsano. You can wave, Sophie, just so that, thank you. Sophie is in the Canadian Domestic Policy Liaison of International Youth Alliance for Family Planning, where she provides evidence-based insight for meaningful youth engagement in municipal, provincial, federal, and global sexual and reproductive health right policy. So Sophie has demonstrated a longstanding commitment to community-led approaches to addressing regressive policies impeding sexual and reproductive health rights and the well-being of vulnerable women, girls, and gender diverse populations, having been appointed the youngest board member of FOS Feministo. So welcome, Sophie. Okay, on the screen with the blue background, we have Megan Doherty. Megan has over 2 decades of experience advocating for sexual reproductive health rights in Ireland, Canada, and globally. As Action Canada's Director of Global Policy and Advocacy, Megan is responsible for leading on the implementation of their strategic objectives to advance SRHR rights in global policies with a particular focus on the UN Human Rights Council. So throughout her career, Megan has collaborated with activists, parliamentarians, civil society, UN agencies, government officials, and many others to support the realization of women's human rights, especially SRHR. And, oh, sorry, I'll pause for applause. Thank you. And finally, right beside me here, we have Ishnavi Ganassikaran, who is currently working as the SRHR Learning and Capacity Strengthening Specialist at Oxfam Canada. So she provides cross-portfolio learning and partner capacity strengthening to support across SRHR projects. She has loads of experience with adolescent sexual and reproductive health rights, HIV/AIDS, LGBTQI+ rights, and youth economic empowerment programming in South Asia, Africa, and Canada. Welcome.
Thank you.
Right, so this is very like to be a great discussion, looking at all the different various views on our panel. So really looking forward to this. And I'm gonna kick off with a bit of a general question about key gaps and focus areas. So like I said earlier, gender inequality is really, it has all the implications for health and especially sexual and reproductive health rights being a bedrock of this. So ensuring good health and well-being for all is really reliant on addressing the specific barriers to accessing safe and affirming sexual and reproductive health rights and services. So from your personal and professional experiences, what are some of the key priorities or opportunities for SRHR work in Canada or in other regions of the world do you see? And also, how are you working to fill them? So I think everyone will have a chance to reply on this one, but maybe we can start with Ishnavi, and then we'll go on to Megan, Dr. Bibi, and then I'll have a separate question for Sophie that is relating more on the youth side. Thanks.
Thank you. It's nice to get this session kick-started. So just to share, I think for Oxfam Canada, one of our key priorities is to make sure that we undertake rights-based and comprehensive approach to our work on SRHR. So this actually includes working on the neglected areas of SRHR, which have been identified by the Future Planning Initiative. So for instance, I'm just gonna share a little bit from our global experiences and work we do across the neglected areas of SRHR. Firstly, comprehensive contraception care. So when we talk about comprehensive contraception care, it goes way beyond just providing a range of contraceptives. I just want to share a little bit of a small story of Chimwemwe, who is one of our Malawi Youth Club members. And she participated in one of our projects, information sessions over a series of them, and has actually taken it upon herself and also to initiate conversations, not just with her boyfriend, but also with other members of the community on contraceptive care. And what I want to emphasize is that comprehensive contraceptive care actually not just debunks myths or misinformation, but actually, when done right, it is an opportunity to challenge social norms, gender roles on contraception, and not just support the individual to make a choice, but also to ensure that couples, families, and any other groupings that are appropriate for that context can make that informed decision. Another neglected area that we work on is safe and legal, ensure that there's safe and legal access to abortion. We work in a number of countries where the abortion laws range from highly restrictive, such as in the Philippines and Malawi, to countries where it is a little bit more liberal, such as in Mozambique. So in 2014, actually, in Mozambique, the national law for abortion was actually liberalized. However, what Oxfam and their partners noticed when they started working in one of the more remote and rural regions of Mozambique is that there was a general lack of awareness about the fact that it is legal and that it is a free service that can be accessed. So a lot of our partners' efforts has actually led to healthcare providers, such as nurses, actually opting to be trained so that they can provide this service to the communities. These are communities where abortion would not even be feasible, or before some of the work that has happened, or women and girls have to travel really long distances to access that service. And we've actually seen women and girls also have come forward to access this service. And we've had community leaders actually join hands as well to ensure that referrals are provided. Women and girls know about this more and more. Beyond this, we also work on youth and youth needs for SRHR. I just want to share this example from our Philippines work. One of our partners, they begin their conversations actually with youth talking about their own body. So what they do is they draw a map of the human body and they talk about parts that give them, bring them pleasure, bring them shame, or they even have questions about it. And the whole premise or the whole intention behind that group activity is to initiate that conversation with youth so that they can start to own their body and respect their body, and in turn actually appreciate and recognize the human rights that they themselves hold and the decision making that they can do about their body. And I will touch a little bit on the last neglected area, which is SRHR advocacy. So Oxfam and its partners has a long-standing history of advocacy work. Again, an example actually from the Philippines is Oxfam and its partners was quite effective over years of lobbying, alliance building, strategizing, collaborating across different stakeholders and like different actors. Actually, we're successful at banning early and child marriage. And that's just like, step one almost if you think about it, because banning early and child marriage is really great. And yes, a positive win. However, there is more to be done to ensure that it gets implemented and that that right is made accessible to women and girls in the Philippines.
Yeah, perfect. Thank you so much. That's really useful. Okay, so Megan, do you have any thoughts?
Yeah, thanks. I think we'll probably have some similarities and lots of agreement that reinforces each other throughout the panel. But just wanted to say hello and thanks for having me today. So when we think about sort of what's on the agenda upcoming around sexual and reproductive health and rights, I think the first thing that comes to mind is everything. There's just so much to do. But I'm going to highlight two Canada-specific examples that Action Canada will be working on over the year. And I think, what's really important to remember is that SRHR, it affects everybody in every country in the world, and there are a lot of similarities to our experiences. It may look different in different contexts, but the rights remain the same and the obligations on the governments remain the same to make sure that we can realize those rights. So in the context of Canada, the first one I wanted to talk about was Pharmacare. And so we know that the Supply and Confidence Agreement between the Liberals and the NDP sets out a commitment to finally move forward on Pharmacare in Canada. And so we need to make sure that the full range of contraceptives is covered under this agreement, as well as treatments for sexually transmitted infections, including HIV and gender-affirming care. We know that cost is a major barrier for many people in Canada in accessing the contraceptive method that works best for them. The patchwork system that we have of private insurance, complicated means and age tests for provincial programs, and the exclusion of certain drugs and devices from formularies, it just doesn't work. People fall through the cracks, especially young people, people with precarious immigration status, people on low income, and people who already face compounded forms of discrimination in the healthcare system. It also means that people don't have access to the contraceptives that work best for them if the main consideration is cost. And so this is simply unacceptable. And it's unacceptable to Action Canada, and it's unacceptable under international human rights standards as well. We know that two-tier systems, they always disadvantage the people with the least social and financial resources. And we don't accept this for other health services, so we should not accept it for sexual and reproductive health services. So what we will be working on at Action Canada is advocating for universal, single-payer, portable, and comprehensive coverage of contraceptives and SRHR medications for everyone, everywhere. And I think you'll be hearing us talk a lot more about it over the coming year. And the second thing I wanted to just mention is Canada is holding Canada accountable for its human rights obligations related to sexuality and gender. And we'll be doing this through the United Nations Universal Periodic Review process. So this is a unique process of the UN Human Rights Council, where each country is reviewed on its entire human rights record every 4.5 years. So every country gets reviewed, all of the standards are the same, and it is one of the most accessible mechanisms at the UN for civil society participation, excuse me, because you don't need to have any particular expertise on the UN and human rights law. And unlike most UN processes, the ways in which you can participate are very clearly laid out and with very defined key moments. Anybody who works within the UN system knows that is a rarity and is a real challenge for civil society engagement. And at Action Canada, this is part of how we work. And so we work as a partner in the Sexual Rights Initiative, which is a coalition of 6 feminist organizations from all parts of the world that work to advance global norms and standards on sexuality and gender. And we have found this process to be especially useful for bringing attention to issues that are stigmatized or neglected, such as abortion access or the rights of sex workers or comprehensive sexuality education. So we'll be engaging in this process over the next year to highlight the human rights obligations of Canada, specifically looking at their obligations to dismantle barriers to abortion care across the country, and to build in effective accountability measures for the monitoring and implementation of sexual and reproductive rights in Canada.
Thank you so much. It's great to hear the global view, the Canadian view. This is really a rich discussion already, so I'm quite excited. Okay, Dr. Bibi, do you have anything to add there?
I think much has been said, so I would just like to kind of reiterate and talk about a little bit about personal experiences on the gaps on SRHR. And I think all in this room, we would greatly agree that there are several gaps in the SRHR programming that require urgent and ongoing commitment for a long time. And these gaps including meeting the needs of women in all their vulnerabilities, especially in humiliating settings, or even in situations of gender-based violence. So these gaps are central to the work needed to address the 4 neglected areas that you just talked about. And we in PLAD International also kind of touch upon those neglected, not just touch upon, but of course they are the core to our programming. starting with comprehensive sexuality education. This is what we also kind of refer to adolescent sexual reproductive health and rights, and it's again focusing on transferring this knowledge and accurate information to adolescents and youth, whether they are in school and out school. And for that, when we talk about global context, we have to work within the culture and the situation that is there and which is acceptable to them. And we take various routes. We talk about organized structures working through the education system, like champions of change, where adolescents are the leaders of their change and they move forward and work with their peers in the schooling system. We also work with out of school children in the form of peer educational modules, where they work with their peers out of school and they take the message onward forward. We also our work also focuses on the gaps that we have, the maternal mortality that we've not been able to, even now WHO site says 800 women, right? So per 20 minutes. So this is a continued effort that we focus on improving the health of young adolescent girls and young women in order to bring about positive outcomes for pregnancy and childbirth. Through which, again, there is a whole process of demand creation, importance of birth preparedness and planning for better health outcomes, and connecting those communities with the healthcare facilities for high quality care and practices. While we talk about this whole continuum of care, there is again the importance of another neglected area we keep talking about is family planning or comprehensive contraceptive care, which I was so astonished of all the efforts that we are doing. I was just this morning looking at statistics, and since 2015 to 2022, the main indicator on family planning, which is the satisfaction of couples by the use of modern contraceptive, is stagnant at 75%. It has not moved. So, and research has proven that that is the lifesaver for a woman. If she has access, or if a couple has access to contraceptive care, we are saving lives. So if we have not been able to achieve that, we are long way beyond for maternal mortality. We do focus on neglected areas in terms of post-abortion care. So it's very interesting. Most of the countries that we work at are culturally very conservative, religious-minded. I mean, I don't need to preach the choir here, but there are some interesting entry points that we work in. So what we do is that when we work at the health facility level in terms of capacity building of healthcare workers, now because of law and culture, we cannot talk about safe abortion or even unsafe abortion complication, but we focus on improving the healthcare providers' capacity in providing post-abortion care. Now, through my own experience also, I have seen many unsafe abortions ending up at the health facilities where they're registered in the registers as post-abortion care. So they do not get accountable and questioned, and a woman is saved at the end of the day. So at least we are trying to use that entry point to kind of, work on it, unless there is an advocacy level change that we can look at. We also work on advocacy on SRHR also, and that is done through through community support groups, that is done through religious groups, that is done through women rights organizations and youth-led organizations, and working in collaboration with feminist organizations. So I think I'll stop at that.
Thanks so much.
Before I get into more
great.
details.
I heard many people mention the areas of neglected parts of SRHR, and I want to come back to that later. But first, I want to give Sophie a little moment to sort of think about the question from that youth youth-led movement perspective. How do you think about some of these issues from that viewpoint?
I think that first and foremost, we need to acknowledge that, simply put, youth understand each other's needs best. We're speaking about neglected areas of sexual and reproductive health and rights. And although youth do not form a homogeneous body, youth are particularly vulnerable in, just undergoing an important period of physical, cognitive, emotional, and social development incomparable to that of adults or young children, and are consequently required informed interventions in settings of humanitarian emergencies, scarcity of resources, or otherwise unmet needs with respect to sexual and reproductive health and rights. And so I've had the privilege of serving as a vice chair for the accountability working group of the WHO's Partnership for Maternal, Newborn, and Child Health. And as the only youth vice chair, I do hold a responsibility in, supporting my colleagues in, prioritizing the decriminalization and provision of safe, affordable, and accessible abortion care, as well as post-abortion care. As well as, just the other panelists referring back to other mentions of comprehensive sexuality education, as well as comprehensive contraception. And, going further and emphasizing the harmonization of policies, as well as partnerships and other financial commitments to adolescent sexual and reproductive health and care. And so in my capacity as the Canadian Domestic Policy Liaison for the IYAFP, I have had that privilege of informing different opportunities and initiatives to incorporate youth and integrate them in these interventions. But still, there is a prevailing understanding of young women and children as the primary casualties of conflict or of unmet need, while still having limited inquiries on the ramifications to social composition and disparities for vulnerability. And so despite youth under the age of 24 accounting for nearly half of the world's total population, a majority of whom live in less economically developed countries, as well as being underrepresented in decision-making bodies, there is a need to recognize young people, in particular adolescent girls, women, and gender diverse individuals, as a neglected population in sexual and reproductive health, as well as a neglected population in accounting for age and gender disaggregated data that informs the interventions that we hold and that we pursue in spaces of sexual and reproductive health. But yes.
Thank you so much. Right, so moving from neglected populations to moving back again to the question I promised to loop back around the neglected areas of SRHR. We were in Canada here, and our Canadian government has the Feminist International Assistance Policy, the FIAP, and it promises to invest in neglected areas of SRHR. So Megan, can you tell us a little bit more about that? What does that actually mean, and where do we need to be focusing?
Sure. So sexual and reproductive health and rights, it encompasses, a broad range of issues and interventions. It's been recognized in international agreements as being fundamental to achieving the Sustainable Development Goals, fulfilling human rights, gender equality. But there remains a persistent underfunding and contestation of the more stigmatized aspects of sexual and reproductive health and rights. And what that means is that these areas, they don't receive funding. They are subject to discriminatory laws and policies, and are related to broader issues of underfunding for feminist and women's movements worldwide. So in response to this, a coalition of Canadian civil society organizations working on human rights, SRHR, feminist solidarity, and movement building, international assistance, and global governance, they came together in 2015 to advocate for greater Canadian leadership on global SRHR. And so through consultations, collaborations, expert guidance, this coalition called the Future Planning Initiative identified 4 key areas that were absolutely critical, but chronically underfunded, and where Canada could have the greatest impact. And so we've touched upon them, but just to reiterate, the 4 areas are comprehensive contraceptive care, safe abortion, adolescent sexual and reproductive health, including comprehensive sexuality education, and advocacy for SRHR. And what is especially important about these 4 areas is that, as I mentioned, they're highly stigmatized, primarily because of harmful gender norms about women and girls' sexuality, their bodies, and their role within societies. And this exists in all countries, including Canada. But also, these areas are so important for us to pay attention to because they are critical interventions that build upon each other. They take into account a person's needs over the course of their life and requires addressing the structural barriers that lead to human rights violations, poor health outcomes, and also that respect the agency and autonomy of women and girls and feminist organizations at the country level to lead the social change necessary to achieve SRHR. So we cannot hope to achieve gender equality or sustainable development if women and girls are denied information, education, and services that they need to make informed decisions about their lives, and also for them to demand accountability from their governments for their failure to uphold their human rights. And also, donors must also take responsibility for their role in cherry picking different aspects of SRHR that serve their own political interests while causing real harm to women and girls and social movements. So as Canada looks to roll out its funding commitment on SRHR, we'll be looking very closely to make sure these 4 neglected areas are receiving the funding that has been promised, but also that the programming and the investments are genuinely taking a human rights-based approach, a gender transformative approach, and a comprehensive approach that is owned and led by the communities and the advocates and feminist movements themselves.
Thank you, great. And I think, Ishnavi, if I'm not mistaken, Oxfam also works a bit on this area, and especially the piece around sort of policy influencing based on feminist principles. Can you tell us a little bit about that?
Sure. Actually, Oxfam Canada is part of the Future Planning Initiative Coalition as well. So you can recognize the commonality in our our fights that we want to fight together. In terms of like the global work, again, one thing I want to emphasize that Megan has already brought up is that SRHR is not new. And I think that's something that keeps getting forgotten, is that this is not a new set of rights that we're fighting for. And I think that is like absolutely critical to emphasize, I would say.
Yeah, perfect. Thank you. All right, so now we're going to move on to talking about how this links to programming. So despite all the progress that's been made so far around SRHR, there's been a lot of challenge to implementation, the quality SRHR programming. So for basically all the panelists, I'll start with Sophie, Megan, Ishnavi, and then I have a specific question for Dr. Bibi. What are some of the key principles that need to be incorporated into programming so that programs are really gender transformative and they really address the root causes of gender inequality rather than just sort of treating SRHR sort of symptoms? Yeah, so I'll start with Sophie, is that okay? Yeah,
sure. As part of the global steering committee for the Partnership for Maternal, Newborn, and Child Health, specifically for the to operationalize the meaningful youth and adolescent and youth engagement commitment. I think that programming, especially in ensuring a gender transformative approach, I've witnessed a lot of programming shift, for the better, for engaging with youth in a way that ensures that the vulnerability of young people in humanitarian settings or settings of unmet need reiterate that youth bear witness to different socioeconomic, political, and cultural contexts, and that needs to be accounted for in the programming, whether that be the delivery or the partnerships. And so the need to engage in meaningful youth and adolescent engagement is significant in addressing the root causes of gender inequities, especially when we consider that youth conjointly make up half of all people living with human immunodeficiency virus as of the last decade, and that youth are particularly vulnerable, just as young women's vulnerability is perpetuated by determinants of early sexual intercourse, low contraceptive use, and other structural barriers to access sexual and reproductive health care. And so acknowledging the pre-existing inequities for women, but specific to adolescent girls, and how that hinders their ability for meaningful engagement is exceptionally significant in the delivery of programming and ensuring that we have a gender transformative approach to international development.
Thank you so much. Okay, Megan?
Thanks. So at Action Canada, we take a human rights-based approach to sexual and reproductive health and rights, which will come as no surprise because I think I've been saying that a lot already. But in its most basic form, this means that we work to develop the capacity of duty bearers, which are usually governments, to meet their obligations, and of individuals to claim their rights. So we do this at Action Canada in a variety of different ways. But this approach, it provides a legal and conceptual framework to shape our advocacy demands and is aligned with and reinforces feminist, intersectional, and reproductive justice frameworks, which is really key. And it's also quite practical. So many people think about human rights as just aspirational, lofty goals of world peace. But in reality, the human rights framework is a really useful tool to develop and analyze public policies, to build accountability mechanisms, to break down the structural barriers that prevent people from realizing their sexual and reproductive rights, and to seek redress when their rights have been violated. And so, in the context of human rights and the approach, it's really grounded in principles of interdependence. So recognizing that all human rights are connected. And so we cannot realize sexual and reproductive rights without the realization of other rights to housing, health, privacy, non-discrimination. Principles of empowerment, accountability, participation, which is particularly key, as Sophie was talking about, for adolescent participation and their right to participate in any of the policies that affect them, but also transparency and particular attention to marginalized or vulnerable groups. And what is really, really great as well about the human rights-based approach is that it's constantly evolving to reflect the current environment in which we are living. There's always new issues that are coming up. And the principles and the frameworks are designed in such a way that they can adapt and provide really helpful guidance that is designed to help people claim their rights and for governments and duty bearers to meet their obligations.
Yeah, I love that. Not everyone thinks of human rights-based approach as being practical. I just love the idea that it can be, and it's also not just something that we write, everywhere. We're human rights-based, it really means something, and there's a practical component to that for sure. Great. So maybe I'll give Ishnavi a chance on this question, and then move over to Dr. Beebe.
Disclaimer, I'm actually a data geek. So I come from a monitoring and evaluation background, and I'm actually going to touch on that because I think, it's one of those topics of programming that is stressful, that people fear. And I just wanted to talk a little bit about my experience and actually Oxfam Canada's experience with feminist meal as an approach to make M&E more transformative in its process and its, in its work. So feminist meal, if you think about it, at its core is about power. So in an international development setting or any kind of, team setting that you can think of, who holds the most amount of power? It's pretty easy to answer that question. So when we think about feminist meal, one of the foundations is to shift power over to our local partners, our project participants, even our communities, depending on who is engaging in that specific activity itself. And honestly, traditionally, feminist meal is seen as something that's more conducive for qualitative methodologies. I can see why, because qualitative methodologies tend to be a little bit more flexible and adaptable, while quantitative survey-based systems are seen as very rigid. However, actually recently for SRHR project, I a team of us, so Oxfam and partners, decided to even test our own understanding or our own boundaries on this feminist meal piece. And we actually looked at integrating it into a quantitative study we needed to do. By we needed to do, I mean, it was, you know, donor requirement. It was in our PIP, right? You have to execute it. But what was beautiful is that this study was meant to, as an objective, one of the key objectives was to assess quality of care that is provided at our project health facilities. So if you honestly just do a Google Scholar search of quality of care, the literature is rigorous. It's there. The methodology is set. There's not really a lot of wiggle room. However, and traditionally what we would have done is hire an external consultant who's an expert, comes in, does the study A to Z, gives us this beautiful report, right? Things happen from it, yes. However, not as effectively as we would have liked it to be. However, what we decided was we actually decided to recognize our own internal knowledge and expertise, especially in our local partners, because we have amazing local partners who are, you know, have so much to give and so much knowledge that never gets integrated into, for example, an M&E exercise. So we formed like this small group of, you know, research team, you could call it. I don't like the word research, but let's just call it a research team of partner representatives who actually designed the study from like the methodology to the survey tools to the data analysis, which meant that every element of it needed to reflect our partner needs so that it was utilization focused. And you know, most of us in a traditional M&E setting can do a baseline with what, 3 or 4 months, you know, multiple countries, go in, go out, get it done, sorted. However, feminist meal does not work that way. It is about the process, because when you're talking about transformative change, it's not just about, is this survey question like perfectly worded? It is a lot more than that, because it is about the partners. In this case, it was about partners, you know, bringing in what they needed to, you know, get out of, not just get out, but like to make sure that this study was useful for them. It took us almost 10 months, which means, you know, donor reporting timelines, funding timelines are always like iffy with that. There's a lot of tension with that comes in. However, you know, any transformative change takes time. Especially when, you know, like Megan and Sophie and others have actually pointed out, when we're tackling some things like social norms, gender norms, power dynamics. And I just want to, share that.
That's great. No, I love that, using a meal example. And you mentioned several times about like local partners and working with local knowledge. And I wanted to, this is something that's very near and dear to my heart, and CARE is really focused on working with local partners and localization agenda. But I think PLAN is also too. So I wanted to ask Dr. Bibi, like, how do you see the role of local partners, local organizations, local communities in ensuring that programming quality?
We both will respond to this question then.
Yeah.
Just as you said that, you know, in PLAN, in all the countries where PLAN International works, we actually work with local partners and communities to ensure our programmatic approaches are contextualized. So we address the context, and we also meet the needs of all the diverse participants. So all the intersectionalities. Now, I would actually take this example by sharing an example of one of our SRHR projects. So we are currently working on an SRHR project called Aspire. It's a Global Affairs Canada funded project in Nigeria. And the ultimate aim of that project is to improve realization of SRHR, sexual reproductive health and rights of adolescent girls and young women. And we are doing that through young women and the vulnerable population also. So it's an inclusive project by addressing the root causes of gender inequalities using a human rights-based approach, to Megan's words again. So PLAN is a big advocate on human rights-based approach too. What happens is that PLAN commits to respond to this multi-faceted, multi-dimensional, you know, dimensional barriers to the adolescent and young girls accessing sexual reproductive health and rights, and even access to protection rights. What we do is we focus on 3 interconnected and multi-sectoral dimensions of change. What we do is we foster on the individual and collective agency, autonomy, and choices of adolescent young women. to claim their rights to SRH and protection. And then while doing that, at the same time, we work towards strengthening the delivery and access to quality, gendered adolescent responsive and inclusive sexually, it's a mouthful, sexually reproductive health services. And even addressing it to the protection services, whereby working with the health facilities and schools. And then a third pillar on that is increasing the accountability of governance structures and the systems towards SRHR and protection. Now, these changes are achieved by three-pronged strategy or approach, we call it. First, what we do is at Plan that we promote young women, adolescent girls and young women as leaders or gender transmitted change. So they lead. What we do is we work towards their empowerment by equipping them or empowering them with accurate knowledge, decision-making capacities, and life skills to realize their rights on SRH. Secondly, what Plan does is that we ensure that the community-based responsibility holders are also as part of this journey towards gender transformative change. That means we work with men, boys, adolescent boys, community leaders, religious leaders for that purpose too, to first of all, understand and admit to the critical importance of gender equality being an issue, and create an enabling environment where adolescent girls can come forward, young women can come forward in terms of decision making and empowerment. And then at the third pillar, what we do is that we ensure that we work with institutions, just like as I mentioned, with the health facilities, even with schools in terms of Aspire and protection agencies, so that all three of them are equipped not in terms of capacity, in terms of training, but they are also equipped in terms of suppliers and equipment, so that they are able to address the needs of these adolescent girls and young women when they come. And then we go a step further also at that because we talk about gender equality, not just treating the symptoms, but we talk about the root causes. So we make sure that we work with these institutions, which means health systems, not just making flowery strategic plans. That always happens. Every 5 years, there's a huge document on strategic planning. And then every year there is an operational annual plan. Okay, what happened to the plan last year? Oh, we never had enough money for that. And now here, Plan is talking to them. Your plan should be gender responsive and gender transformative. So what we do is we go and sit back with them on their plans, and we open and unpack those budgets, that those budgets are actually responding to if they want a facility to be gender responsive and adolescent friendly, they need to have 1, 2, 3, 4, 5 things in place. So we work on budgeting level, and then we talk about advocacy. There are those beautiful policies that are lying on shelves for years and years, adolescent responsive young policies at national. Oh, we have it. Okay, let's open it. That's another question. Just recently, I was visiting Nigeria, and very interestingly, I mean, I'm talking too much, but sorry.
No,
I have met a federal representative, and he is working on a quality of care. You just reminded me, quality of care. He says every program comes and does works in silos on quality of care, malaria, maternal health, We want a uniform quality of care. And I was like, okay, so what have you done? He said, I've done the situation analysis, and it's done, and WHO has funded it. I'm like, what next? He's like, there's nothing else. Now I'm waiting for others. So look at the piecemeal. We talk about quality of care. We talk about changes at national level, at policy level, but things are piecemeal. So partners are not coming together to work towards a continuous process. So that's something that I kind of get frustrated about when I think about it. But coming back to the system strengthening, in addition to the health facility, we work towards schools also, because health facilities are just termed or thought of as fixing places, fixing the disease. There are schools where there are young adolescents who are facing the issues around SRHR, even realizing that it would be a normal process, right? And then, for example, talking about gender-based violence, I just talked about, okay, a case with gender-based violence could come and we could train the healthcare providers to manage them, to treat them. But what then? What about the protection? What about the legal aid? So in Aspire, again, the first time around, we're actually working with this third sector also, that, okay, if somebody is managed at the first level of care at the facility, they should then be referred to the level where they need protection and other legal aid also. And while we are doing all this, there is an umbrella partnership and collaboration that we are doing with women rights organizations, local women rights organizations, and youth-led organizations at multiple levels. So not just the grassroots level and not just the national level, but linking them together so that they start speaking to each other. They start collecting the evidence from the grassroots level, and they're able to bring it to the policymakers and decision makers with evidence around SRHR and actually raise their voice to claim their SRHR rights. So this is kind of a...
Thank you so much.
You thought I'll never end, right?
No, I'm a programming person by heart, and I could just listen to these stories all day long. I just love it. And these are really optimistic, exciting stories of change and what could be improved, what are our lessons learned. It's really exciting. And I hate to change the topic now because it is so exciting, but I feel like I would be amiss if I didn't mention some of the devastating rollbacks that we're seeing right now on SRHR, including things like access to abortion in countries like the United States. This is a question for anyone. What do you foresee as some Canadian or global repercussions of that type of setback? What do you see for the future now that we're seeing this? Any order, but I'll ask maybe Megan, Vishnari, Sophie, and Dr. Wiebe last. Does that sound okay?
Yeah.
Megan? Yeah.
So the news coming out of the United States is very disheartening, really angry and sad, and in solidarity with all of the abortion providers, abortion funds, activists and advocates that will be working really hard to make sure that people can access the care that they need. And I think that, we saw with the leak decision, sort of the media storm that happened in Canada about it, and, we'll probably have another one when the decision comes out, probably, in the next couple of weeks. I think it's really important to remember that we have a different legal and policy context in Canada than in the United States. And so on the one hand, we mustn't get distracted by bad faith debates that actually serve no one or our reality in Canada. And in Canada, our focus must be on expanding access to abortion and dismantling the barriers to equal access across the country for all people. We are moving forward. We are not going backwards. But second, all that being said, what is happening in the US is the result of decades of erosion of democratic institutions, attacks on women's rights, trans rights, LGBT rights, with disproportionate impacts on people who are racialized, people living on low incomes, people living with disabilities, and those with precarious immigration status. And it's also not unique to the US. So we're seeing it in places like Hungary and Poland, Egypt, Ecuador, Brazil, China, India, Uganda. I was talking to one of my colleagues this morning in Poland, and she told me that last week, the government introduced a new law that was going to set up a registry of pregnant women. So women who are pregnant were going to have to get registered, and as we know, access to abortion is criminalized in almost all circumstances within Poland. Like these things don't happen out of the blue. And what we're finding is that opposition to sexual and reproductive rights, they bind many political agendas. But really at their center is a goal of upholding racist, patriarchal, and capitalist ideologies. You have two countries that you think, would not be aligned on anything whatsoever, but they are both opposed to sexual and reproductive health and rights. And what does that tell you? And so I think it would be a mistake to think that, that we are somehow immune in Canada. And, the recent events of the trucker convoy or occupation, showed us that we are not immune to these kinds of things. And so we must be very vigilant, and we must also refuse to accept these incremental shifts in public discourse that somehow dehumanizes people, that promotes violence and toxic masculinity, that pits one group against another as if we're in some sort of game of winners and losers. And that serves to really disenfranchise us from participating in our own societies. So we have to pay attention, and we have to push back against these, these things that may seem small in the moment, but when you put them all together, they amount to a real erosion of rights. And so we have to pay attention. That's my main message there.
Those are really all really good reminders. Okay. That's a great start. Do you want to add anything to that?
Sure. Actually, agreed that these rollbacks and the negative, or us losing hard-fought gains is very depressing. However, one thing maybe for me that gets me out of the bed and still continuing in my job is, some of the gains that we've had recently as well, like, some massive positive legislative changes in Latin America, whether it's like abortion laws in, for example, Argentina or Colombia. And like, I think that is something that at least gets me to move forward and continue on this journey. And, one of the things is like this conversation about SRHR, and again, going back to the fact that SRHR is not anything new, it is a set of human rights that has been recognized internationally for years now, is to make sure that this conversation stays at the forefront, right, of any kind of discussions. And this is where I and Oxfam Canada actually believes that grassroots level organizations such as civil society organizations, women's rights organizations, or any actors that support diverse SOGS identities, they are the ones who needs to be funded and supported to make sure that this conversation doesn't die down, and that we keep going at it and make sure that people don't become complacent and let these hard-fought gains slide backwards. Today, actually, in the morning before lunch, some of the panelists, reiterated the same things. And I think, honestly, that is like one critical piece of work that needs to continue on to make sure our grassroots level organizations are supported. And actually, I just want to share an example from our Philippines is we actually have, as part of our project work, even flexible funding for our partners that they can direct it towards their own self-determined like organizational capacity building work. And I just want to share this beautiful example, actually, of our partner CCAP in the Philippines. Their primary work used to be on disaster risk management or disaster risk reduction, previous to their engagement in one of our SRHR programs. And they were actually able to use the flexible funding to build their own SRHR capacity, and now are one of those amazing organizations that are doing a great job of using evidence to actually convince community leaders, norm setters to talk about SRHR and actually make some gains in that space. So just want to reiterate that the conversation needs to continue, and grassroots level organizations for sure.
Yeah, that's a great example. We're all passionate. Sophie, do you want to take this one from maybe a youth perspective?
Sure. I'll start by acknowledging that, although Roe v. Wade established a significant precedent in recognizing and protecting safe and legal abortion, and recognizing it as essential to guaranteeing the right to life, health, and bodily autonomy, marginalized communities have always remained disproportionately vulnerable to barriers in affordability, geographic accessibility, and procedural availability. And so it would be misconstrued to assume that the repercussions of the Supreme Court's ruling are to impact gestating persons within as well as beyond the borders of the US equally. It is the Black women whose maternal mortality rate is 3 times that of white women in the United States who will face the greatest burden. It is also the nearly 20% of youth under the age of 18 living in poverty or faced with economic insecurity who are already navigating barriers such as parental consent, unfeasible geographic travel, amid abortion deserts that are only set to be exacerbated, as well as non-universal healthcare. And so in Canada, we remain highly dependent on the case of R.V. Morgan Taylor, which brought forth imperative conclusions to ensure that the right to self-determination of gestating persons took precedence on the state's interests in regulating reproduction. But the landmark did not establish abortion as a right constitutionally protected under the Canadian Charter of Rights and Freedoms. And so we keep that in mind in that the case invites Parliament to introduce additional limitations to accessibility, especially under provincial regulations. And although those would contravene the Canada Health Act, they do remain threatening. And so we do need to keep an eye out on those. And despite no such legislation being introduced to Parliament since 1991, sexual and reproductive rights have been destabilized in the past with policies undermining the mandate of, standardizing comprehensive sexuality education, or, providing adequate responses to sexual and gender-based violence, as well as compromises to ample universal healthcare on the basis of gender identity or sexual orientation. And so, although it is worth reiterating that 20th and 21st century discourse on women's reproductive rights and autonomy in Canada has demonstrated a shift from measures to prevent abortion in the aim of defending the virtue of motherhood, to those liberalizing and decriminalizing the procedure in the aim to recognize women's agency over their reproductive health. It is also worth reiterating that women, girls, and gender diverse persons in low and middle income countries or communities are most vulnerable to catastrophic loss. And so, we refer back to Latin America and the Caribbean, and seeing, incredible accomplishments and achievements in the decriminalization and liberalization of abortion in Argentina, in Mexico. But we also refer back to the destructive neocolonial and inhumane global gag rule that remains to be, permanently repealed. And so acknowledging the gross influence of the US on Canadian policy as well as other foreign policy, it's important that we keep an eye out on the way that it may influence the sexual and reproductive health access in Canada as well as abroad.
Yeah, those are really important points, and that undue influence and the need to be watchful and to be on top of things here in Canada and around the world, and to push towards the sexual reproductive right health agenda, including safe abortion. Great, so this has been a marvelous discussion. We've kind of gone all of the way around. We talked about sort of what are the sexual reproductive health rights that are the most neglected right now, which groups may not be benefiting from some of the policies and practices going on. We talked about implementation, what are best practices, meal even. We talked about these recent changes in the context, the global context around SRHR. Looking at all this, it's a question to all of the panelists and for all the participants to think about. What are the forward-looking solutions now? We talked about it all, but where do we go from here? Like how do we continue to really galvanize that support for more diverse and really inclusive sexual and reproductive health policies, investments, programming? How do we make this all happen? So I'd love to hear all the panelists speak, if you're willing, on this one, because it's a really important what next question. So maybe I can start with Ishnavi and then move to Sophie, Megan, and then Dr. Bibi in that order. But if anyone feels really excited, like you could jump in out of order. So go ahead.
Anyone wanting to jump in? No? I think I can just reiterate actually something that Megan said earlier, was that, on the way forward, it's like the Canadian government had made a big promise or commitment during Women Deliver, and they need to actually do something about it and put it to action. And I think for us Canadians in Canada, we need to be loud about our support for SRHR, not just domestically, but also internationally. When we, going back to the, commitment that was made at Women Deliver, Global Affairs Canada, for example, needs a clear policy on SRHR so that we make sure that the funding or the investments are directed or guided towards more of a rights-based comprehensive approach to SRHR, and not just handed out in a tokenistic manner without much of a regard of the impact of what it will have. In addition to that, like an accountability framework to make sure that we can track the progress, but also like see the impact and the, again, holding the government accountable. And I just want to emphasize that feminist transformative health programming will require long-term thinking and vision. Like it can't be something that can be achieved in 2 years, 3 years. I wish, I guess I'm sure all of us would wish that actually. Yeah. And that actually means making that funds available available in a manner that it is long-term, flexible and accessible for especially the grassroots level civil society organizations, women's rights organizations. One example of doing that is like feminist grant making sure that the granting or the requirements to be eligible are made more flexible so that we can ensure those grassroots level organizations that at times actually can't be registered, for example, and self-identified as a women's rights organization because they work in contexts where it actually puts them at risk to publicly, announce themselves as a women's rights organization. So I think it's important that, we look at this funding opportunities in a more flexible and adaptable manner. And a bunch of you probably, or most of you have experience with Global Affairs Canada projects. Their reporting and compliance requirements are onerous. Like it is so hard for our partners who most often are small and grassroots level organizations. They get buried in just meeting the compliance requirements that it takes them away from doing the critical work that they need to do, which is make sure that SRHR is accessible for all. And so what I would say is, along with feminist grant making, Global Affairs Canada needs to look at revising or at least reconsidering some parts of their compliance and reporting requirements to make sure that we're setting these organizations up for success and we're not just like setting them up for failures. So
yeah, totally agree there. And like the donor Global Affairs Canada has some really cool feminist programming like Women Voice and Leadership, but those principles should really be applied to all the programming as well. That learning can be applied much more broadly. So I'll give chance to Sophie now.
Of course. I'll echo those sentiments on accountability as well, referring back to, the Canadian government's commitment to funding youth-led organizations, especially in sexual and reproductive health and rights advocacy, as well as, efforts for programming and specific to comprehensive sexuality education. I think that with that, we need to ensure accountability in supporting youth and harnessing funding that is currently, essentially non-existent for youth groups to adequately advocate for their communities' unmet needs, as well as for community-led organizations in the space for sexual and reproductive health. I refer back to some statistics in that in 2018, the UN estimated that 135.7 million people were in need of humanitarian aid across 25 countries in the world, where over 12 million were stateless young persons in need of those, that scarcity of resources, really impeding specifically on their heightened risk of poor reproductive health outcomes. And so there is a need for consistency in both the quality and accessibility of services provided across different settings. But there is an emphasis on, again, accessibility, whether that be in our policies or in practice. There is a concern for youth and their intersecting identities to access the proper care that they are in need of, especially with, our shifting notion of permanent emergencies with the pandemic. It has brought forth discourse on the distinction of a relief period to one of rehabilitation. And we see this, again, echoing the sentiments said prior, there is, concern for sustainability and ensuring both short-term viability and long-term improvements to poverty and other insecurity, and understanding that the categorization of vulnerability is made more difficult under these circumstances where, we've been under the conditions of a public health pandemic for the past two and a half years. And so there is a need for accountability in the commitments that are made, both with financial commitments, and with the monitoring of interventions aimed at improving the health outcomes of adolescent girls and other marginalized communities.
Thank you. Great. Megan?
So I don't know, there isn't a whole lot more to say than what others have said, but perhaps my big takeaway is to support and amplify the feminist movements, the sexual and reproductive health activists and advocates who are doing this work every single day and around the world and also in Canada. Your local sexual health center works really hard with no money and no predictability and are often a key touch point for people in your community. So we cannot forget that these local sexual health centers exist in Canada too, and they need our support. Also join that movement, right? Being an advocate and an activist on sexual and reproductive health and rights is, I know, for me, it's the best thing I've ever done with my life. And so I am also then a member of the community that I serve. And we are all shouting from the rooftops that this work is fundamental to democracy, to human rights, to gender equality, to economic justice, to racial justice. And we and all of the activists around the world, we need money, we need political support, we need community support, and an enabling legal and policy environment to carry out that work. So maybe my parting word would be listen to the people who are doing the work.
Hear, hear. That's great. I love that. Okay.
I think I don't disagree with all the three panel speakers, but I do want to really, really emphasize on taking the health system strengthening approach also. Because I think we could see that historically funding for SRHR has been very focused and emphasized on short-term fixes rather than a robust strengthening of health facilities. I mean, an example of that is the COVID-19 pandemic hit and SRHR is down the drain. Because the first thing in these countries that I work with, the first spots that were taken up for these triages, I'm not saying that why did they do it, but were the adolescent corners, the corners where adolescents would come and seek consultations and talk and communication counseling, get some education and information material from. The second places that were knocked out were waiting areas for pregnant women or adolescents that would come for ANC and communication counseling. So unless we make SRHR as a core element of healthcare, it will keep on dropping down and we'll keep on pulling it up. So we need to make it as part of core healthcare because it's a human right, right? And the second thing, again, there are three things. So the second thing is working while we wait for the movement with our women's rights organizations and advocacies. We need to work with another entry point, work with our professionals, medical schools, because there's a great value challenging, like thinking that needs to be challenged with these healthcare providers also in terms of SRHR as a need of adolescents also, because we talk about adolescent care. So that is very important because in that way we are going to have more gatekeepers that would reduce stigma barriers when it comes to the rollout of programs. And the third thing which is important is translating research into policy. Each time we have a funding, we do research, then we have the results, and then it goes on the shelf again, and then we wait for another project. And partly the blame is because the process of translating research into policy is so rigid, and it takes like forever. So maybe working a little bit towards that, whatever results we get. I mean, think about magnesium sulfate, this 1-2 cent tablet, which prevents postpartum hemorrhage. When the mother gives birth and she bleeds, this one medication, the 2 cents medication, can save her life. It went through rigorous research for years and years and years. And now it's on all essential medical lists, and it has actually dropped the maternal mortality. So let's start thinking about putting all the research into policy so that even if the funding goes off, it's part of the skeletal of each project, each country as part of their mandate. So
thank you so much. Thanks. So I will do the very difficult task of trying to summarize a few of the key points we've heard today. But then I encourage the panelists to come and sort of like, you missed this, hot pursuit, like one final thought before I go. And then we'll wrap up from there. So what I've heard today is that we really need to work on sexual and reproductive health care that is feminist. It's very, like diversity is a key priority and inclusive. I heard a lot about localization and decolonization. Maybe we didn't use those words, but really around involving local partners, local advocates, local organizations, local movements, and just kind of like amplifying what they're doing, not telling them what to do, just funding them, let them do their good stuff without telling them what to do. So doing that partnership model where we're supporting and resourcing and sort of, bringing resources to those organizations and just supporting them to do what they want to do. And really taking a longer term approach, realizing that this is a journey and feminist sexual reproductive health rights will not be achieved in a couple of years, maybe not 3 years, maybe not 4 years, but it's a process that we're moving towards. And taking a really rights-based approach to sexual reproductive health rights, recognizing those groups that are most vulnerable, bringing them in, ensuring voices, ensuring that they're leading with regards to designing and rolling out services that are meant to benefit them the most. And I think those were some of the key points, but now's your moment to correct me before we wrap up. Any of the panelists want to add?
Signed and sealed.
Oh, it's approved. Anyone in the audience want to shout out something that I forgot? Vigilant, yeah.
Saw one hand go on.
Yeah.
So my name is Patrick, and I come from the so I just about 2 months ago. Working for an organization called Uganda Youth and Adolescent Health Forum. So, and representative was previously I sat on the board for the Partnership for Maternity and Child Health. So, I think one of the discussions are incredible. Things that really that people should come into this conversation, especially if we are to the rising rates of teenage pregnancy. For example, majority of the third world countries, you notice that unwanted pregnancies, maternal mortality and morbidity is largely among adolescents and young people who do not have access to contraception. They do not have access to comprehensive sexuality education, largely because of the barriers that you talked about. But the game changers are if girls are kept in school. The more we keep these girls in school, the lesser we will protect them. Rather, the higher we'll protect them from, pregnancy. And evidence from UNFPA has made that clear, and UNICEF. 2 is technology, because majority of developing countries still have really very conservative laws on sexuality education. But we have an opportunity with ICT, where we can make this information accessible and available. Like, for example, we've seen over the years, access to mobile phones in Africa is increasing, especially among the youth populations, including access to connectivity, the internet. So how do we, for me, I would rather think that we need to put focus on how do we utilize innovations and technology, to take advantage of that. And then very, very lastly is speaking on health system strengthening and adolescent health as well. I think the shift also needs to move from, providing youth-friendly services and all that to actually building adolescent responsive healthcare systems. Such youth-friendly service is not just a component, but it is well embedded and integrated. Because the moment developing countries can get it well with ensuring that their young people and adolescents, and here we're talking about 24 and below, if we can see numbers increase with access to contraception, then we will greatly reduce most of the things we're talking about. Yeah, I just wanted to say that. Thank you.
Thank you so much. Thank you.
Well said.
Okay, I don't know if Julia has anything final to add for those points. But first, before we hand over to her, I just want to thank all the panelists. All of you just led such a great discussions here today and really made such amazing contributions. Thank you for the audience as well, for listening, for shouting out contributions. This was a really great discussion. So I just want to thank the panelists.
Thank you. And thank you, moderator excellence, par excellence. So that's a wrap for day one of the official conference program. We do have an amazing reception where you can move into some networking and hear from two really exceptional keynote speakers, both of whom I'm really looking forward to hearing from. Award-winning Canadian author Farzana Doctor and CEO and founder of NICS, Joanna Griffiths. And both, like I said, we've been trying to get to these events and out and engaging with us. And so we're just really looking forward to them speaking. The program will be a cash bar as well as some hors d'oeuvres will be ready, and they're just setting it up. It'll be ready in about 15-20 minutes. And then we'll do the short program midway through, and then there'll be some more time to eat and have beverages and relax. So we're looking to wrap up the program by 7:30 so we can all crash into bed and think about, digest everything we've heard today, and sort of work through the experience of being once again with large groups of people. And so please come back tomorrow morning, bright and early, 9 a.m. We're going to have an amazing opening keynote speaker, and then a day much like this one. We've tried to plan it as a little bit less intense to allow for that digestion and lots of time for you to connect with one another, but lots of exciting things, including closing out the conference with the Honorable Maryam Monsef, who was one of the founding thinkers about some of this work that many of you have spoken about. So we're really excited to hear from her and many other great speakers. So we'll see you tomorrow morning at 9 a.m. and we'll enjoy some beverages together now. Thanks, everyone.